Well, NBC4's Annette Ariela shows us how Riverside County hospitals are working through this surge.
We had hoped for a bump, but it's not a bump. It's a surge.
Jose Arballo of the Riverside County Health Department discussing the dire situation as regional hospitals reach zero capacity for intensive care beds.
The rising cases and everything else, our numbers will not look good for the foreseeable future.
Coronavirus patients in need of critical care are flooding medical centers all across the Southland, with ICU availability now just at 2.7%. In Riverside County, their hospitalization numbers have nearly doubled since the summer.
During the peak of the previous peak of the pandemic, our highest hospitalization was 550. And so, and then it was taxing on our health system. So imagine 930 hospitalizations.
And of those 930, about 20% of them are in intensive care, the majority on ventilators.
The equipment isn't the issue, supplies or everything like that. It is the personnel that really is the challenge.
Medical staff stretched thin as hospitals get slammed following the Thanksgiving holiday get-togethers.
Extremely remorseful patients once they know how sick they are or how sick their family members are, in terms of thinking about it and perhaps saying to themselves, I wish we had not done that.
Medical centers are now implementing surge plans in order to make room for those infected. Everything from postponing elective surgeries to releasing stable patients. A stressful period for those healthcare workers who've been on the front lines of the pandemic for months now.
It just feels sometimes like there is no end, although now we know there is a light at the end of this dark tunnel of COVID we are going through.
Dr. Radhakrishna referring to the vaccines, but still delivering a sobering reminder, hoping that the aftermath of the gatherings of the past holiday will encourage people to stay safe at home for the end of the year celebrations. Annette Arriola, NBC4 News.